Hi, this is Dr Thorn. I'm speaking for Adapt Live. I'd like to thank the team at Adapt Your Life for the opportunity to speak to everybody again today. For those of you who don't know me, who didn't see my first video for Adapt, my name is Dr Thorn. I'm a cardiologist and obesity medicine specialist practicing in Arlington, Virginia, just across the river from Washington, D.C. I have been practicing obesity medicine now for the past, I guess it's been about 6.5 years now, and I came to this career path through my interest in preventive cardiology and the desire to really help my patients avoid having heart disease and problems in the first place rather than treating it after the fact. I'm not going to belabor the introduction. I can watch my first video and where I explained a little bit more about my own path and changes in thinking about nutrition and heart disease risk and obesity. But to suffice it to say, I've had a lot of great success in my practice with this focus, and have been using a very low carbohydrate ketogenic lifestyle approach with my patients for all of this time. Before I go further, I wanted to announce that I'm going to be speaking at an Adapt event. It's called Adapt Washington, D.C. The event's going to be here at Virginia Hospital Center, which is where I practice, on September 30th. And the speakers will be myself, as well as Mary Lou Hopkins, who's a nurse who works with me, and Eric Westman, who I'm sure most of you are familiar with. And we're going to be talking about a number of topics regarding low-carb lifestyles and the role of carbohydrate restriction in the prevention of chronic diseases. So the link for the event is, if you go to it, I'm going to read it here, and I'm sure will be in the notes. But the link is, if you type in MailChimp, that's MailChimp /AdaptYourLife/Washington-2018. And there's a link to the site describing the event, and a link to purchase tickets for the event. So I hope that many of you will be able to attend. I think it should be really a lot of fun, and you'll learn a lot. And I'm certainly looking forward to hearing my co-speakers. So the topic I wanted to talk about today is one that it comes up very frequently in my practice, and in fact, probably 90% of the time when I have a new patient. And that topic is what is the role of fat in the diet? Of course, for the past half century or so, the conventional wisdom has been that fat in the diet is something to be avoided and is harmful. And with a low carbohydrate lifestyle, of course, the message is very different, and that can be a hard contradiction for people to work their minds around. So one of the things that I spend a fair bit of time doing with my patients is helping them understand why they need to think about this differently, despite the conventional wisdom, despite everything that they've been taught previously, or the things they think they know. The other way in which this topic becomes very relevant and important is that even for those of us who feel very confident in our choices and have a good understanding of the role of fat in the diet and are not afraid of what it's going to do to us from a health standpoint, we often find ourselves in situations where we have to talk to friends and family members and colleagues who have concerns regarding, oh, and I see that my aunt is watching, so speaking of family members, who have concerns regarding our health, or it may make them concerned about their health. Sometimes they just want to criticize, but in any case, we have to have a conversation about our lifestyle choice, and it can be helpful to have a structure of how to have that conversation. So that's what I'm going to talk about today. And so I think the first question that comes up and that makes this difficult for so many folks is this idea that if it's okay to eat fat, how on earth could the message from people we trust, the government, our healthcare providers, the media, how could this message have been wrong for 50 years? And that can be a very hard thing to understand. Now, certainly you can delve very deeply into the research articles and pull out a lot of data. That's not what I'm going to do here today. It gets complex. Frankly, I have to look that stuff up. What I want to do is just give more of a general framework of how we went so wrong. I think it's important to understand how the idea came about and what was the original science that got this ball rolling. Many of you are probably familiar with the story of Ancel Keys. And so Ancel Keys was a very prominent scientist in the mid part of the last century. And he did an observational study, supervised it, called the 7-Country Study. And in this study, he purported to show a relationship between fat intake in various countries and the rates of cardiovascular disease. But in this study, as with many studies since then, this was purely an observation of a correlation. So there was a connection there, but it didn't explain what that connection was, and it didn't control for a number of what we call confounding variables, which can be things that are measured, or more importantly, many times things that are unmeasured that could influence the relationship, but and that don't have anything to do with the two things that are purportedly linked. One of those things, of course, being sugar intake and refined carbohydrate intake. But ultimately, this led to more studies that were done, and in fact, some randomized studies where there were two groups and they were given different diets. And these studies purportedly showed that the fat, and especially saturated fat in the diet, led to cardiovascular disease. Now, this is how everything got started, and eventually the American Heart Association in the 1960s adopted the low-fat message as a way to prevent heart disease and a recommendation for the population at large. And then in the late 70s and early 80s, the U.S. government adopted the same message. But the key thing to keep in mind here, I think, is that these original studies that were done were very, in a sense, rudimentary. They may have been the best that could have been done at the time, but don't stand up to the way science is done in the modern age. Particularly, epidemiologic science was not as sophisticated 50 years ago, and the initial trials that were done had a very difficult time controlling for variables, and so there were multiple ways in which the groups compared were different, not just the fat content of their diet. And in fact, doing any sort of study, even nowadays, of course, on diet and its role in health in human beings is extremely difficult to do, extraordinarily expensive, and even doing the perfect trial, it's nigh impossible to control only one variable, because when you change one thing in somebody's diet, inevitably there's other things that are changing. But in any case, this message took hold. Now, a point that's made very well by Gary Taubes, who many of you are probably familiar with, is Gary points out that if a scientific idea, if a hypothesis is correct, then what one would expect is that over time, the evidence in support of that hypothesis should accumulate. It should become stronger. When we look at the case of the so-called diet heart hypothesis, the idea that fat in the diet will lead to heart disease, the accumulation and strengthening of the data has not occurred at all, and in fact, quite the opposite. More recent evidence suggests that there is no link. But what's happened is the bodies that make the decisions about what the government and the medical establishment recommend, the so-called guidelines creators, are still relying on the old data. So in fact, for those of you who are interested in reading more, I published a piece with Nina Teicholz about a year ago on Medscape. So if you just do a Google search for Medscape and put my name in or Nina's name, you should be able to find the article. And it was a rebuttal to the most recent doubling down, so to speak, of the American Heart Association on this low saturated fat recommendation. And in the American Heart Association recommendations, they really relied on 4 studies done in the 1960s and early 70s, the same original studies, and it just doesn't hold up any longer. Now, I think it's important to say that while certainly there are quite a few financial interests, industry and economic interests that care deeply about guidelines and recommendations on diet, I think that overall, people who were involved in formulating recommendations in science are well-meaning people, but there are some factors that I think can help us understand why maybe they got this wrong and why so many people were convinced that are worth mentioning. So first of all, there was a lack of consideration of the complexity of the effects of cholesterol, of fats. So it is true that saturated fats will, generally speaking, raise cholesterol. And back 60 or 70 years ago, when people first started measuring cholesterol, the main thing that was measured and most easily measured was a total cholesterol. The standard practice was not to obtain lipid panels on patients. And even now, I still have patients in my office that they want to know what their total cholesterol is. And this focus makes it hard to appreciate how different foods can affect the cholesterol, because when saturated fats raise cholesterol, what's happening is that the HDL, the so-called good cholesterol, goes up, which is a good thing. Now, the LDL cholesterol often goes up as well. It certainly can. The degree of which can be different for different individuals, but in most cases, the ratio of the total or the LDL cholesterol to the HDL cholesterol stays the same, and that's a pretty good marker of overall risk, and suggests that overall risk is not changing. But people weren't measuring HDL and LDL back at the time that these ideas came about. Certainly, they weren't measuring further breakdowns of the LDL particle sizes and numbers. Concepts of things like remnant cholesterol and even triglycerides just weren't appreciated at that time. And so I think that this helps us kind of understand why people ended up led down this primrose path of that we had a simple solution to the problem of heart disease in limiting fat. The other factor that I think is very instructive and can help us understand how, as a society and certainly as a medical establishment, we got off track, is that the role of trans fats in our diets and human health was not understood when the low-fat hypothesis was being developed. So trans fats are a specific subtype of fat that, generally speaking, are... Somebody said I just disappeared, although it still says live here. If anybody else can't see, please comment. But in any case, trans fats, for the most part in our diets, are present because of an industrial process by which hydrogen is essentially injected into liquid fats to turn them solid. And it was a way to solve a problem. So you could turn liquid fats like vegetable oils into spreads and use them for cooking, Crisco being a great example. And trans fats were used in extending the shelf life of baked goods. So very useful for the modern food industry. But what trans fats do to us in terms of our cholesterol is they actually lower the HDL, the good cholesterol, and they raise the LDL cholesterol. So exactly the opposite effect of what one would like to see for cardiovascular risk reduction. And in fact, trans fats nowadays are really thought to be a significant risk factor for cardiovascular disease, primarily because of the effects on the cholesterol. But when dietary policy was first being developed by the American Heart Association, by the U.S. government, the role of trans fats was not appreciated, it was not understood, and it was only in the 1990s that this really became a better understood issue. And in fact, for the past 15 years or so, the FDA has regulated trans fats and significantly limited their presence and use in our diet. But because this wasn't understood, I think that a number of the, to the extent that there were negative effects of the cholesterol on the cholesterol that were appreciated by scientists 50, 60 years ago, what they may have been seeing to some extent at least, and even in the studies, was the effects of excessive trans fat intake, not the effects of real natural fats. So I think this threw people off. But in any case, I think that this explains how we came to be where we are in terms of our thinking. So that being said, if we take it as true, and I think we should, that the idea behind the dietary heart hypothesis that fats in our diet are bad for us is not proven and hasn't stood up. But then the question is, well, then does it make sense that fats would be good for us? Or is there, how do we put this together to understand why fats wouldn't be bad? And maybe this is a discussion that shouldn't need to be had. I mean, I don't know that the burden of proof should be on proving the safety of fats, but I find that it can be very helpful in talking with patients and others to pose some logical arguments and ways of thinking about fats in the diet that can help us understand why fats should be, in most cases, part of a healthy diet. So one of the best ways to think about this, I think, is in evolutionary terms. Now, nobody knows for certain what people ate in prehistoric times, and rates of chronic diseases can be difficult to know, but generally speaking, what we do know is that for many populations across the globe, natural fats have been part of the diets that populations ate through most of human history. And my way of thinking is it's hard to think that something that was a important nutrient source for most of evolution would be inherently harmful. And while we don't definitively know what the prevalence was, the frequency of chronic diseases in prehistoric or even current hunter-gatherer societies, what we do know is that it likely was low, certainly from a clinical and standpoint, and so there are numerous reports from over a century ago when hunter-gatherer populations were more common, and what is noted is that there's very low frequency of chronic, so-called non-communicable, non-contagious diseases in those populations. Heart disease just wasn't a big issue. Some will look at that and say, well, yes, of course, but those people were dying at a young age. Now, I'm not an evolutionary biologist and not an expert on this topic, but my understanding from the reading I've done is that if one wasn't killed early through infant mortality or infection or violent death, then even in a primitive society, one could expect to have a lifespan that could in many cases be identical to that of a modern society, and certainly rates of disability, morbidity from chronic diseases was much lower. And then, while heart disease can be a more difficult thing to assess, the rates of other chronic diseases, particularly diabetes, were very clearly less, even in Western societies, until the last century. And this is best described in Gary Taubes' most recent book, The Case Against Sugar. And anybody who hasn't read The Case Against Sugar, I'd highly recommend it. It's just a fantastic discussion of both the health aspects of sugar, or unhealthful aspects, and the role of sugar in driving metabolic diseases, and a really fascinating look at the history of sugar in our culture. So just from an evolutionary standpoint, though, I think it doesn't make a lot of sense that if we're eating real foods, unprocessed foods, that fats would be harmful. Now, the other logical argument that I make to my patients is that what we know about fat accumulation in the human body is that the main hormone driving fat growth is insulin. Well, insulin is driven by carbohydrates, not fats. And so while foods containing more fats are certainly more energy dense, that it doesn't follow that they will cause fat gain or weight gain, because they do not drive the main hormone that contributes to fat storage. When it comes to diabetes is not a disease of fat metabolism. Diabetes is a disease of carbohydrate metabolism, inability to regulate blood sugars because our bodies can't handle carbohydrates. And so it doesn't make sense that avoiding fat would be the primary solution to that. And so I think from the understanding we have of human physiology and biology, which granted is very complex and there's a lot of arguments to be made here, but broadly speaking, I think that it's at least equally plausible, and to me certainly more plausible, that a diet that's higher in fat and lower in carbohydrate would work better from a physiologic standpoint. And the other thing I think it's very important to stress, and that I spend a lot of time talking to my patients about, is that the context of the way you're eating fats in the diet matters. So in one way of looking at our metabolism, so people often talk about metabolism being fast or slow, and I have a slow metabolic rate, and that's how we tend to talk about metabolism. But I don't think that's particularly helpful. It's not like we have a knob we can just turn and set our metabolic rate. So whether your metabolic rate's fast or slow, that's not something that you can manipulate. And so I think the better way to talk about metabolism, which essentially is referring to the way our bodies utilize food to produce energy, is in terms of what is our main fuel source. And you can look at any sort of food that we eat, and there's essentially three main nutrients, the so-called macronutrients, and that's fat, carbohydrate, starch, and protein. And the way I think about protein is it's more of a building block, and certainly our bodies can utilize protein for energy, but I think the main function and purpose of protein in our diet is to support, muscles, bones, organs. It's mainly structural. And so when it comes to energy production, our main sources of energy are starch, carbohydrate, or fat. And one way to think about the way our bodies function and the way we use food to produce energy is that we're almost like a hybrid automobile. So a hybrid car is going to run on electricity, or it could run on gasoline, but generally speaking, it doesn't do both at the same time. It's one or the other. Our bodies are similar in that while there may be a lot of negative health effects from eating a diet that's high in starch and sugar, especially for those of us who are very sensitive, we certainly can use carbohydrate to produce energy. Our bodies burn sugar well. In fact, I'm partial to the idea that maybe the reason our bodies preferentially burn sugar is because it's so harmful that we want to get rid of it. So in any case, we from an energy production standpoint, we can run on starch and sugar. On the other hand, our bodies burn fat very well also, and we can run on fat as an energy source. But we don't do both at the same time. Not most of us, not very well. And so some people are good at switching back and forth. Others of us, we don't switch so well. And so the problem comes in is that when you're eating too much sugar and starch, what that is depends on the individual, of course. But if it's too much for you and your body's running off of carbohydrate, then your body doesn't burn fat very well. And in this setting, if you eat fat, it's like taking that hybrid car that's running on electricity and you're doing short trips around town all the time. If you go to the gas station and fill up the tank, what do you end up with? A fuller gas tank. And if you keep filling the gas tank, eventually it's going to overflow and make a big mess. So our bodies are kind of similar. And if we're running off sugar and starch and we eat fat, then what's going to happen? Well, we store it. It may be harmful. It may hurt us. And so I think that when you think about it that way, then that makes it more clear that if we're going to eat a diet that's higher in fat, then we do need to cut the carbs, and we got to find the right balance. Now, when we reduce the sugar and carbohydrate enough, that allows our body to transition over, just like taking the hybrid out on the open road. And now, literally, I tell my patients, literally, we become fat-burning machines. It sounds kind of trite, but it's the truth. So when you're adapted and when your carbohydrate intake's low and you're burning fat, then it's hard to imagine how on earth the fat could be harmful because you're burning it. And so it's not going to hurt you if it's not there. And so that matters. And in fact, it's very interesting. Studies have been done on people following both high fat versus high carbohydrate diets. And the patients who are eating more fat have lower levels of fat in the bloodstream. And so if fat's harmful, isn't that what you would want? So in any case, I think that this kind of way of thinking about metabolism can really help understand why fats are okay, and also why fats may not be so good if you're not reducing your carbohydrates low enough for you. And that's, sometimes the problem we run into is we have patients who come back and maybe the lab results look worse, but they haven't necessarily been doing exactly what we're advising and instructing them to do. And in that case, we always emphasize, well, if you're still eating carbs and you're eating a lot of fat, that is not what we recommend. So that's I think an important message to get across, and that can be helpful for understanding. For me, the other thing that I go to, the other idea I go to when I'm thinking about why fat isn't harmful and what I talk to my patients about is my personal experience as a physician. And I've now taken care of a lot of patients where we use a high-fat, low-carbohydrate lifestyle. And what we see is that, and this is supported in the literature, is that cholesterol doesn't get worse on average. Now, I talked about this some in my last video, and so I'm not necessarily going to belabor the points here, but on a higher fat, low carbohydrate diet, what is almost universal is that there'll be an increase, certainly no worsening, of the HDL cholesterol over time. Triglycerides almost always go significantly lower. So these are good things. And then on average, the LDL cholesterol, the so-called bad cholesterol, doesn't change. And so we see this over and over again. And when the LDL goes up, usually the ratio stays the same. And so from the standpoint of what happens with cholesterol, my observation experience is that on balance, most people do better. And even if a small number of people may have worse cholesterol, you have to look at that in context of all the other risk markers. And that's something you can keep track of. And there's nothing that says you can't go back to eating differently or you can't make changes in the future. But why wouldn't you try eating more fat and less carbohydrates and see what happens? Because it may work really well, and you won't know unless you try it. My experience is that diabetes gets tremendously better. And diabetes is probably the number one risk factor these days for heart disease. We generally tell patients that if you have diabetes, your risk of having a heart attack is as high as somebody without diabetes who actually has already had a heart attack. So that is really powerful. And it strikes me as very implausible that a nutritional approach, a high-fat, low-carbohydrate nutritional approach that markedly improves diabetes without medications is going to cause heart attacks. It doesn't make any sense. And then here it's a lot. Certainly, this is not research science, and it's harder to say. But my observation and experience with my patients is that I'm not seeing patients going to the hospital with chest pain or heart disease who I'm treating with carbohydrate restriction. Now, I don't have the data to tell you that they're doing any better either. I just don't, that takes big research studies which haven't been done. But certainly, if this was as dire as many would suggest, then I would question, then how come I'm not seeing the harmful effects in my patients? Because it's been 6 years now, over. Lastly, I'm just going to throw out a couple of more specific scientific support, I think, that supports the idea that fats are not inherently harmful in the diet. So one is that the largest study ever done of a low-fat diet was a study called the Women's Health Initiative. And they studied, I believe it was 49,000 women. And a proportion of those women were put on a very low-fat diet, and the others, they said, just follow the usual general prudent approach, which was not necessarily high-fat. This certainly wasn't a low-carb diet, but it was higher in fat than the intervention group. And what they found at the end of, I think they went out 9 years or something like that, and what they found at the end of it is that there was no reduction in heart disease whatsoever. So certainly going on a very low-fat diet is clearly not beneficial. That's been well studied. And so you can tell anybody you're talking to that the largest study of a low-fat diet ever done showed no benefit. The funny thing is the way the researchers spun the study was that it proved that low-fat diets were not the cause of diabetes. That's a little disingenuous. The other research that I think can be helpful is in studies on the Mediterranean diet. So there have been two studies. The larger one published most recently within, I believe, the past 5 years or so. And so the Mediterranean diet is a general approach, which is a little hard to define, but generally speaking, most people would envision a Mediterranean diet as being one that's high in unprocessed foods, lots of fruits and vegetables, and lean meats. But importantly, either or both high levels of olive oil and nuts, and so significantly higher in fat than a low-fat diet. And what these studies on the Mediterranean diet have shown is that heart disease rates are lower on this higher fat diet. And that's not explained by differences in cholesterol. And so, you might ask, well, why bring up the Mediterranean diet when you support a very low carbohydrate, or even for many people, a ketogenic lifestyle as being best for health? And the reason is that I think that if fat was the cause of the problem, then the best approach should be a low-fat diet, and it's not. So I think that this is, the Mediterranean diet studies are black swans, so to speak. They kind of prove that the original hypothesis is wrong. End of story. So I think that that's why looking at those Mediterranean diet studies are important. That being said, the question that sometimes comes up as well, shouldn't we be recommending a Mediterranean diet since that's proven to be beneficial? And I think a lot of cardiologists do recommend Mediterranean diets. And there I take issue. Just because we prove the Mediterranean diet is better than a low-fat diet, essentially the way I would look at that is that, okay, you found a diet that's better than what's probably the worst diet, which is a very low-fat diet, and just because it's better than that doesn't mean it's the best thing for most people. So, for instance, let's say we did a study of smoking reduction, and we took never would this study be done, but let's say we took a big group of people and had them smoke a pack of cigarettes a day, and then another group of people and told them to smoke half a pack of cigarettes a day. And guess what? The people smoking half a pack of cigarettes a day had less heart disease. Well, the corollary of that would not be to then tell the whole population at large that they should be smoking half a pack of cigarettes a day. Instead, the answer is still no cigarettes. So with diet, just because a Mediterranean diet is better than very low fat, it doesn't mean that that's the best approach. And that's going to lead me to my last point before I wrap up, which is that the best approach is going to be very individual. And so in this discussion about why fat's not harmful, what I'm not saying is that everybody needs to go out and eat tons and tons of fat. And what I'm saying is that all of us need to figure out what nutritional approach works best for us. We need to assess that based on how we feel, based on what our weight does, based on getting blood tests and looking at our lab markers of health and risk, and we need to find an approach that's sustainable and eat things we like, and in fact, for most people, by reducing sugars and carbohydrates in the diet, while the proportion of fat goes up from a percentage standpoint, it doesn't necessarily mean we're going to be eating lots more fat, because generally speaking, fat is satiating. Protein is satiating. And so it's, while we call it sometimes a high-fat diet or a high-fat lifestyle, it actually doesn't necessarily mean we're eating more fat than any of those other people who are looking at our plates and asking us how it's safe. But it's more of a proportion thing. And so it's all about finding our individual approach that works best. So I hope that this talk has been helpful for making you more comfortable with your dietary choices. Maybe gives you some ideas and discussion points to talk about with family and friends and colleagues. Again, I'd like to thank Adapt Live. I would recommend everybody subscribing to the Adapt Live or the Adapt Your Life channel on Facebook and YouTube. It's really been a great experience. I've really enjoyed being able to get my message out on the Adapt Live videos. And I would really like to encourage anybody who's close to or in the DC area or wants to come. On September 30th, we're having our event, the Adapt Washington, DC. Again, the link, it's MailChimp, MailChimp/adaptyourlife/Washington-2018, and should be in the notes, I think. So you'll get a chance to hear Dr. Westman speak, as well as myself and Mary Lou Hopkins, the nurse who works closely with me, who is the best nutrition and metabolic health coach that I've ever known. And Dr. Westman's going to be doing a workshop in addition to talking. So I think it's going to be a lot of fun, and I look forward to seeing everybody there. So I think that about wraps it up. Thanks everybody for watching, and look forward to hearing from you in the comments and interacting. And go ahead and throw in any questions you have for me. Everybody have a good day. Have a great weekend.